I don't know who needs to hear this, but it is okay to ask for help when you need it, and it is okay to want to feel better, and that goes for all of us. Dr. Todd Thatcher is here to tell us about how medication management and therapy can benefit those struggling with mental health. Thank you so much for joining us today.
Thank you.
We are so glad to have you. So let's just launch right on into this. So let's talk a little bit about medication management and what that means with mental health.
Well, what it means is, we were talking earlier with Julie in therapy. Therapy can help with some things, but there are some things then that you need a little extra help, and that's where medications come in. And so we, are fortunate to live in a day and age of psychiatry where we have a lot of medications available to us that are safe and effective. And so we like to give them to help people live better lives.
Well, and I think this is, you nailed this. Now we have this day and age, modern science exists for a reason, and we're able to take advantage of it, and there's no shame in that. I think a lot of times, I know, especially even in my generation, it was, rub some dirt in it, walk it off, but it's okay to ask for help and to get medications, and then combined with therapy, I would think that would be incredibly powerful.
Well, it is, and there's a lot of, just like with talking with a therapist, there's a lot of stigma to be on a psychiatric medication as well, which is really unfortunate because there's a lot of things that problems that people seek out medical help for that there isn't a lot of stigma involved with. So hypertension, if you have high blood pressure, go get on a high blood pressure med. If other methods of bringing your blood pressure down, like diet and exercise and things, have failed, maybe you need a blood pressure med to avoid worse outcomes later. So it's really the same equation or the same logic with the medication in psychiatry. If you need the medication, then go get evaluated for it.
Right. It's a medical condition. It's nothing to do with you. It's an actual chemical imbalance, and you need help, and there's no problem in that. Let's talk a little bit about that stigma. I'm sure you've seen some sad stories of people not getting the help that they needed, right?
Oh, absolutely. And the stigma, things that are going on in your brain and behind your eyeballs as you look out at life, right? That's who you are. So we tend to look at mental health problems as there's something wrong with me. If someone breaks their leg or someone has diabetes, we don't look at them as there's something defective with you as a person. But when it comes to a mental health problem, somehow, oh, you're defective, which is really not true at all. The brain is the most important organ in your body, and so it has a tremendous influence on the rest of you. And if your brain isn't operating properly like any other organ in your body, then go get it evaluated, and if you need a medication to help things work better, then get that help.
Well, and I would imagine combining a medication with therapy would improve success rate, right?
Yeah, and in fact, that's what evidence-based medicine tells us for most conditions. Combining therapy with medications is very effective. In fact, it's usually the most effective. The reason is the medications are good at fixing some things, but they're not good at fixing all things. And so things particularly that they're not good at fixing is, if you're having difficulty with, for example, self-concept or self-esteem, dealing with past memories and traumas. Okay, we can treat some of the symptoms that may be getting in the way now of your anxiety system acting up, but you really need to be talking with someone in addition in therapy to work through some of those problems and how to think better and get better coping skills and build resilience.
And that's what's so great about what you guys are doing is you're offering that overall wellness. Where can people go for more information?
Valleycares.com is an excellent source to begin.
Great. Thank you so much, Doctor.